Now joining us via phone from Abuja is Dr. Faisal Shuaib, Executive Director, National Primary Healthcare Development Agency. Good morning and thank you for joining us on TVC Breakfast. All right, for 32 years, Nigeria has ensured to sustain the fight against polio, and now it is going to be declared polio-free today. How excited are you, and why did it take us this long?
Right, this is a very huge moment for all Nigerians, and my excitement, has no bounds. It's taken a long time, but we're finally here. It's come from a lot of hard work, a lot of leadership, a lot of innovation on the parts of Nigerians. And really, if I was an Olympian, this would probably be the Olympics for me. The only reality is that this is not a game, this is real life. We've gone through so many challenging periods. There was a time when the oral polio vaccine was thought to be anti-fertility. You can also imagine how we had to get the communities to buy in. Thanks to the traditional leaders, religious leaders in our communities. Of course, there was also the issues around insecurity in the Northeast. We're this close to finishing in 2016 when we suffered a setback when 4 wild polio viruses were actually reported in Borno State, northeastern Nigeria. But because of the leadership provided by the President Muhammadu Buhari, who stood up to the challenge, he pulled us, by the shoulders and said, "You cannot afford to despair. This is the time when you have to go back and look for more viruses. Here is 9.8 billion naira. Make sure that you contain the outbreak." The Honorable Minister of Health, the Aliko Dangote, philanthropists, Bill Gates, our partners, and all staff of the Federal Ministry of Health and NPHCDA all pulled together in one direction, working with the communities, working with the frontline workers. This is what got us here, but it did not come without a lot of blood, sweat, and tears. But really, we're excited about this amazing journey that we've been on. And finally, today, we're going to be certified as a polio-free nation. And it is a moment for all Nigerians to be very proud of this work. It is triumph in the face of very difficult circumstances. It is the same polio structures that we've used in the last few years. Thanks to so many ministers, thanks to so many executive directors of NPHCDA, thanks to many Nigerians, we've been able to use the same polio structures to overcome Ebola. We've been able to improve our routine immunization. And it is the same polio structures that the Presidential Task Force under Boss Mustafa is using to deploy to different communities to do risk communication so that we can, within the shortest possible time, flatten the curve when it comes to the COVID-19 pandemic.
All right, Dr. Shuaib, let me say congratulations to you for your effort, your leadership effort and doggedness, and also congratulations to all Nigerians for these feats being achieved right now. But however, walk us through the process. What does it take to certify any country free of polio? Nigeria is not the only country that is being certified at this period. We understand South Sudan and several other countries are also in the mix.
Right, so for any country to be certified polio-free, you have to show evidence that there's no circulating wild polio virus in your country. So what the WHO, the regional office of WHO, has done is to set up an independent body known as the African Regional Certification Committee that goes to each and every country. They've been in Nigeria. They were in the southern part of Nigeria last year in November and December. Then just before the outbreak of COVID-19 in Nigeria, they were here in February and then stayed over till March. So they went through all of the documentation and made sure that they went to a lot of the communities, looking at all of the evidence to show that we are actually looking for the wild polio viruses and we're not finding anything. They are looking at healthy kids. They're looking at all of the evidences from environmental sampling. So taking random samples from sewage sites, just to make sure that apart from circulation within human beings, that in the environment there is no circulation.
All right, quickly before we let you go, Dr. Shuaib, now that we are here, what are the plans moving forward to ensure that we sustain what we have achieved so far?
We have to do more of the same in terms of making sure that our communities are involved. There's continuous buy-in. We have to make sure that the resources provided by the governors continue to flow. They've also provided leadership. We have to continue to encourage parents and guardians to take kids for routine immunization, because we have to continue to maintain the population immunity. So there's still a whole lot of work that needs to be done to make sure that the virus is not imported from Pakistan or Afghanistan. And that is the work that the Federal Ministry of Health and the NPHCDA have committed to doing. That will continue. We will not relent. If there's anything, we'll even do more, because being certified polio-free means that we've got what it takes to get the job done. But sustaining the resilience, that's what we're going to keep doing.
All right. Dr. Faisal Shuaib, Executive Director, National Primary Healthcare Development Agency, thank you for your time on the program this morning.
Thank you for having me. It's been an honor.
Right.